Hi, I'm Dr. Margie Danchin. I'm a vaccine researcher with over 15 years of experience, particularly in vaccine acceptance, confidence and uptake. And at the moment, we know there are a lot of questions and concerns about the COVID-19 vaccines being used in the Australian rollout. And so today we're going to try and answer your questions as honestly and as openly as we can. Why should I get vaccinated? So that is the important question, of course, at the moment on everybody's lips. It's so important for us to get vaccinated to protect ourselves from getting COVID disease or COVID illness. And we know that we're more likely to get sicker the older we get. In fact, the risk of getting very sick or going to hospital or being admitted to ICU or even dying increases threefold for every 10 years that we get older. So it's really important that we protect ourselves from severe disease, but also that we protect our families and our loved ones and everyone else in the community. The problem at the moment is that people really don't feel like they are going to get COVID disease in the community in Australia because cases are so low. So it doesn't feel like a direct threat to everyone at the moment. But unfortunately, COVID disease can increase quickly in the community at any time through breaches in hotel quarantine or any number of reasons. And of course, there are also lots of broader benefits of vaccination as well, particularly freedom from lockdowns and school closures and being able to travel again. Okay, are the vaccines safe? So the COVID-19 vaccines have been extensively tested for safety in the clinical trials before they're introduced into the population. But like any other vaccine or any other medicine, the vaccines do have side effects. And in fact, the COVID-19 vaccines have common and expected side effects that occur really quite often. Up to half to 3/4 of people may experience a sore arm or headache, fatigue or lethargy or muscle aches or even fever. So people need to expect that they will experience those side effects in the 1 to 2 days after having the vaccine. They may need Panadol or Nurofen. Very uncommonly, they may need a day at home or a day off work. But those things are to be expected and they do occur really commonly. The more serious side effects are, of course, very rare. And they include things like anaphylaxis or a severe allergic reaction, which occurs anywhere from 1 to 5 per million doses. And the other serious adverse event is the thrombosis with thrombocytopenia syndrome, or TTS, that has been shown to occur with the AstraZeneca vaccine. And that is also very rare. And the only risk factor so far that has been identified for the clotting syndrome is age. And it occurs more commonly in younger people, people under the age of 60, where the risk is estimated to be probably 31 people per million, or 3.1 per 100,000. And then for people over the age of 60, it's about 1.8 per 100,000 or 18 per million. Thanks for your questions. I hope I've been able to address some of yours today, but please stay tuned for more.